So, my lecture was given a different name, but I decided to focus on these issues. They just seemed more important. Of course, if I could, I would tell you much more, but let's focus. Okay, so the topics are cumulative exposure assessment and gaps in protection. So when we're talking about exposure assessment, the problem is that we forget that this is actually an environmental pollutant, and although we cannot see our life without it anymore, several of us can't, I can, but and I'm actually a very, very cruel mother who does not let her children use their cell phones as much as they like. My oldest, who's 17, has a cell phone. The ones who are 14 and 11 have a phone only to call home that has no internet, and they only got that because they live in Jerusalem and they go on the buses and there are terror attacks. Otherwise, they wouldn't have even that. And of course, they're the only ones in their schools who don't have WhatsApp, and they don't get information about the exams and about the homework. And it's very difficult because the school's policies make it necessary for the children to have cell phones, and my children don't. Okay, so if we're talking about gaps in exposure assessment, I was very lucky to get funding from the Environmental Health Trust to go and meet Professor Gandhi in the United States. And he was the one who started the talk about the underestimation of the SAR exposure regarding children, because the phones are certified according to a certain degree of SAR that's allowed to penetrate the body, but the children are exposed more. And they're also exposed to home cordless phones, which might seem like a small problem. It's just a regular phone, and it's only connected to its base station and not to the antennas outside. But actually, the radiation levels from the home cordless phones are even higher. They're like being next to a base station. And we don't think about that, but that is going on inside people's homes all the time. There are other home exposures. We've actually published about this. I wrote 2 chapters together with Professor Hanninen from Finland, who has been studying the issue for several years. So actually, humans, it's natural for humans to have physical, like it's obvious that humans would have some effects because humans are like receiving antennas. They are not just biological creatures, they also have physical properties, like physics properties. They have iron in their bodies and they have magnetite crystals in their bodies. And if we look at houses, for example, how houses are constructed, if we have steel reinforced concrete, it may not allow the radiation to enter, but if it enters through a window, then it will just be reflected inside the house, jump around, and form standing waves and hotspots. If someone lives in the house over here, then they would have RF exposure from this mast and ELF exposure from that. And this same mast is right above a playground, next to a kindergarten, and next to a school. And like, I wanted to rent this house, and then I took my meter and walked around. The other side was really nice, but this side had extremely high radiation, and I looked for it and I found it on the roof of the house next door. And in Israel, you see this all the time. I even discussed it with Stilian about one house that I wanted to rent, and then he said, "Oh, it's no problem, my son lived there." Okay, so I think that the problem is that people believe that there is a problem or is not a problem. About the same number, you can believe something and he can believe something else. So the numbers that he believed were okay for his grandchildren were certainly not okay for my baby. The masts, like, there is no mast sharing in Israel. That is also a policy thing. Like, why should there be 2 masts right above this sports area and playground? And there's a kindergarten here and a school across the road. Teenagers are exposed in the home. They charge their cell phones next to their beds, and they sit on the beds and they play with their cell phones. And they will have Wi-Fi wherever you allow them to. And if you look at the schools, people are saying, okay, so this kid is exposed, so we're already assessing. This kid is exposed to this, and the ones in front. And if they put it on their lap, they're exposed in their laps. But what about, look, this is like a first grade classroom that isn't supposed to have Wi-Fi. I got this from a parent activist. They do have Wi-Fi.
Those were first graders?
No, those were not first graders, but according to the Ministry of Education, you're not allowed to have, they're not supposed to be exposed before grade 3, but this was photographed in grade 1. But the difference between having Wi-Fi at home and having it in the school is that at home you would have information, very little information passing through, like one car driving on the street. But in the school, you have all those children we saw before, with all those computers, all of them emitting radiation. The problem isn't just the one device on the ceiling, it's all the devices emitting all the radiation. And it's never really fully turned off. And it does also pollute the environment during the weekends because it's not turned off. And you mustn't forget that besides the radio frequency fields, the laptops and the other devices, they have a range of other frequencies that are emitted. So at one of my arguments with Sigal Sadetsky about this issue, she said, okay, if someone is electro-hypersensitive and I eliminate the Wi-Fi, then they'll still be hypersensitive to all these other frequencies. But as I'll show soon, usually the people become hypersensitive after the Wi-Fi exposures because there's something that drives their brains, like they can't tolerate it. And then they also become hypersensitive to the ELFs. But after you remove the exposure and you let their body rest a bit, then they can be next to electrical devices and they do feel better eventually.
Just one quick comment to that. On the previous Stein, all those frequencies fade away after like 40 centimeters from the device.
Okay.
None. Does not have either.
Okay.
It stays a couple of meters and the exposure is different.
Okay.
If you want to eliminate this exposure, you bring a keyboard and a mouse. One keyboard and a mouse, that's it.
Okay, that's a very, very important comment. Thank you. And
Sorry.
yes.
But we need a microphone to pick this up.
It's not
Excuse me.
really
Wait,
irrelevant.
I'm going to go back.
The
Wait.
exposure.
Let's go back and please get here first. Get here. His comment.
That's the question.
Yes, please. Let
Make
him
the
ask the
comment.
question first. No, I got it. Respond. Okay.
Regarding all those non-RF frequencies, usually when you measure them, you see that they are coming down, they're actually eliminated or very low levels after 20 centimeters, 40 centimeters from the device. So if you want to remove the exposure or reduce this exposure, just bring a wired keyboard and a wired mouse and you finish with the issue. You don't put it on your lap, you put it on your desktop and use a keyboard and mouse. The RF, not in SAR. If you measure in SAR, it will be only 20 centimeters. But if you measure in volt per meter or in microwatt per square centimeters, you can measure it 5 meters, 10 meters away. And we EHS people also can feel it from 5 or 10 meters away. And we cannot feel that after 1 meter. Thank you.
Claudia?
Well, no, I agree, partially agree, but we need to take care. Depending on the power, you can measure extremely low frequencies, many meters from. If we had a meter here, 2 meters below this light,
Wait, I also
we
have
can
a
measure
comment about that. That is not the presentation.
the source
I have a meter.
with its low frequencies, perhaps lower than kilohertz, and then we think always needs to be considered.
I just have also a comment about that is not in the presentation. We did a study at Hadassah that we exposed rats to frequencies to sonar frequencies because they thought that it might make the calcium in their hearts eliminate or something, and it did the opposite. They accumulated calcium in their hearts. And then we did exactly the same thing with electricity frequencies. We just put cell phone chargers next to these rats, and what they found was they were extremely shocked. Like the rats had a very high level of calcification in their heart, which is from ELF frequencies. And okay, you just reminded me of that by your comment. So this colleague of mine, Mikko from Finland, he did a study to check where you should place the routers or the modems so that you would have less exposure. And he showed, I think, that actually 1 meter away was more problematic. 30 centimeters was better than 1 meter away, but much better was when it was just outside the view and a bit outside the workplace. But this is a very important slide. I think that electrical engineers know how the Wi-Fi works. It works on, especially here, these in Israel, these protocols are used. It has frequency hopping spread spectrum. It jumps between different frequencies, and the person is actually exposed 2.4 billion pulses per second. And our brain, we don't know how, but it does some effort to perceive this. And besides that, there is also the beacon signal, which is emitted about 102 microseconds. Every 0.1 seconds, there is a signal telling other devices, if you want to connect, then I am available. And it's interesting. Where is that? Oh, that's one of the ones you removed. Okay, and this has been shown that in the 80s, there was a book. Oh shit! Okay, the slide is not here. So a book by Felix Ullman from the Pharmacy School of the Hebrew University. He published in 1980 about this, and he says that back then he showed studies, or he himself conducted several studies. Evidence was accumulating that pulsed radiation, actually it's the shape of the wave that is more effective in producing biological effects than continuous radiation. Is it the pulsing? Is it the repetition rate? Is it the peak power? Are these effects additive or synergistic? We don't exactly know. But one of the slides that is missing here was a German doctor who showed that...
It's still there.
It's still there?
Yes, it's still there.
So I want to see it.
It comes afterwards.
Okay, so I'll show it later. There was a study I found about, they connected the electrode to people's brains and looked at the event-related potentials, and they showed that when there is Wi-Fi on, it takes away from the attentional resources and the working memory of the brain. And they showed it more in men, in boys than in girls, which means that if we are adding these signals to a room where students are trying to study mathematics, then they just have to make that much more effort to understand what they're being taught. And if we're discussing pulsed waves, then why are we putting pulsed waves in everybody's home? I presented this at a conference about human rights, and I think that if a child is electrohypersensitive and we're putting a pulsed wave exposure outside every single home, then some children will practically become refugees because they cannot stay home. The American Academy of Environmental Medicine has reported that patients do come to physicians and report that they have physical symptoms after smart meters are installed in their homes. Children specifically can't even go on public transport without being exposed. I took this picture of Wi-Fi in the bus, and you have Wi-Fi's in the trains, which is exactly like our rats who were exposed inside the cages, and you have Wi-Fi in aircraft now. And you also have the ELF exposure in public transport, which is exactly like our rats. So actually, you can see that people have different kinds of exposures that, if we're looking at exposure assessment, it should be multimodal. There are different kinds of exposures, even inside, if we're just looking at electromagnetic fields. Of course, there are also other health-related things which have nothing to do with this. And you should also look where they are. They're indoors, they're outdoors, they're in the public space, they're in school, they're at home. And there's also this Internet of Things that I find very problematic with you. You never know. What you looked at might be looking back at you and might be recording you and might be doing things to you. Okay, now the next really important thing is that the people who are actually making the decisions in public health, in the committees, in the worldwide committees, are the physicists and the engineers. And like, I stood outside with Benny Klein, who is a very informed guy, and we listened to a couple of engineers from this group talking, and he told me, I don't understand what they're saying. So there is a completely different language that these people are talking and these people are talking. So I, as a physician who wanted to study electromagnetic radiation, I went and took classes with Professor Uri Feldman, who talked here, because I said it doesn't make sense that I don't know the physics. But the people like Sigal Sadetsky, which is actually, this is my criticism of her, she says, I don't know the technological side. I refuse to study it. It's not my field. I rely on the engineers and the physicists. I think that is not correct. I think that a person has to know and understand and make decisions based on personal understanding, not based on recommendations that you don't really understand what they're saying. The standards today are still based on thermal effects, although we've had science for 40 years showing that they do not protect. This person who wrote this statement is a German physician who went over the science from the Russians and many documents. And they were commissioned by the German government, and they produced a report of 120 pages, which was then archived and not shown to anybody. So he has been publishing it in a brochure series, and it's available on the web. And of course, there's a bioinitiative report that summarizes the peer-reviewed literature. They didn't do their own science. They just took the literature, they looked at it, they summarized it, and they've reported a bunch of effects which are certainly not only thermal. And there are some scientists who are now rediscovering things that have been discussed 30 years ago and 40 years ago, that neurons are capable of detecting temperature changes even if the temperature isn't changed by the cell phone. Even they didn't have cell phones then, but they had radars. About the excuse my voice, about the Wi-Fi in school issue, the Tnuda website offers a lot of information. It really does. Serena already sorted the water. Thanks. So my criticism of the Tnuda website is that it gives the information, but then the bottom lines are the problem. The bottom line says the risks are uncertain. The discussion is still going on. You should know that most of the public is exposed anyway, and that even if the children are exposed much more to cell phones and this Wi-Fi doesn't really make a difference. And then come the people from the education ministry and from the municipalities, and they say, listen, the website says that there is no problem. I try to tell that to Sadetsky, and she says, I just provide information. But I have a problem with providing information with no bottom line. Okay, so the Ministry of Environmental Protection is giving out a bottom line. They're saying this is unjustified exposure, having 20 laptops in a classroom. We think that a wired network should be used.
Slide, okay, this is
From Stillian, yes.
Okay. And so they're officially saying to use a wired network.
Yes.
And this is also on the Januda website?
Yes, they say that if a school is not using, not Tnuda, no, it's from the Ministry of Environmental Protection website. Tnuda haven't put this on their website.
It's not on the website.
No.
That's an email that Professor Gelder
No.
sent
No,
me.
that is question and answers from
Answers
Guido.
that I
Wait,
asked
we
him,
need this on the, we need the,
but
excuse me.
no one is
We
distributing
need
it.
the microphone. Please, let's try to get the microphone. This is very important. Would you start again and clarify?
Okay, this is an email that Professor Gelberg sent to me on August after I had a meeting with him, and I sent him 14 questions, and this is an email of 14 questions and answers, but this information doesn't distribute on any place, not on Tnuda website, not on the Environment Ministry website, and I'm distributing it to parents, but nobody knows this information.
No, but in the Knesset, Stilian always says the formal recommendation of our Ministry of Environmental Protection is that if there is exposure, it must first be justified. And he always says, I think that if there is a possibility to put a wired network, it is not justified to use wireless internet while other alternatives, safer alternatives exist. He says
Right.
that all the time.
Right.
So maybe a policy, go ahead.
Maybe the problem with it is that he says that, but it's not being circulated. We are circulating it, the activists.
Yeah. Okay, can I go on, please?
Well, then it seems like a policy recommendation here would be to have this, for example, Reuven, could you take what you have done and we make it more available? We certainly can. Environmental Health Trust can do this, but then you can translate it. Tamar, this is a health issue, is it not? And Haggai, you have a comment on how do we get this information more before the public?
My comment is about the discussion. I think because we are touching very, very important and sensitive issues, it's important. Stelian is not here, Sigal is not here. It's important to divide the personal issue from
No, it's
the
not
subject.
a personal. Oh, it's not a personal issue
Okay,
at all.
so if it's not a
It's a
personal,
policy issue.
no, no.
Wha-
So if it's
it
not,
has nothing
if it's
to do
not
with Sigal's
personal, I
personality.
strongly suggest just to make the discussion more fruitful. I strongly suggest just to avoid, personal comments and about the
No.
talk about the subject for
I
all
was
of us.
saying-
I'm
I
just
was
saying for all
saying-
of us. Just
yeah.
stick to the subject. Speak about the claims
Mhm.
and avoid, because then we miss the
Correct.
audience and other people listening. Okay, so I'm just to all of us just
Yes.
to focus on the facts, and there is a discussion about the facts, which is okay, and leave out the not the personal in any negative
No,
sense, but
no.
just in the
No,
sense
but
that
what I said was that this is the website. It gives the information, but the bottom lines are vague. The bottom lines are the risks are uncertain. It's nothing to do. It's not a personal thing. This website gives information. It does not give bottom lines. Okay, this, and then the Ministry of Environment do give bottom line when you ask them. Perhaps they're not out there, but when you ask them, they do give bottom line. They say, we think that this and that. Okay? They also say, I also asked them, and they also say in various places that the ministry actually has no authority about the responsibility of regarding the wireless in the schools is not the responsibility of the Ministry of Environmental Protection, because the law says this equipment does not need to get permission to be installed in a school. And also about the measurements, they are responsible for the measurements, but there are no real protocols for these measurements, and it's still being examined as part of a research project. So when other people say, so what happened is that the municipalities, what started, actually the Ministry of Health and a joint commission gave very good recommendations not to put Wi-Fi in schools. But then the Ministry of Education and the municipalities just went ahead and did install the Wi-Fi in the schools without asking anybody. And they said, okay, today when you ask them, they said, the website Nuda doesn't say that there is a problem, because the website gives information, but it does not say that there is a problem. It doesn't say don't do it. And then the Ministry of Environmental Protection say that what I told you, that it's not justified. On the other hand, they don't really have any approved guidelines, and they don't know exactly how to measure Wi-Fi. So how are these people relying on these measurements when these measurements are not approved? And then the Ministry of Health really are not experts on the topic, so they rely on the TNUDA website. And the TNUDA website says that things are unclear, so it doesn't say no, and then it goes around and around in a circle. I don't think this is anybody's personal problem. I'm saying that there is a problem of policy that is not clear. But what happens at the end? The Jerusalem municipalities say, my policy is whatever the Ministry of Health tell me to do. But they are very vague about what they tell them to do. And then a group of parents came to them and we said, we want wired network in our school. And they said, no, you cannot have a wired network. We only give wireless, and the Ministry of Health's website, Nuda, says it's okay. So why should I allow you? Why should I invest money in putting a wired network in your school? If you don't like it, just remove your child from the school. Okay? I think this is a great problem of policy that is not coordinated and is not clear. And
Keep the microphones moving, please. Where are they?
yeah, I just have one last slide, okay? Okay, so my summary, what I try to tell you is that when we're doing exposure assessment, we can't just concentrate on one thing. We have to look at the different exposures and the multi-exposures in the indoor and the outdoor of the different modes of exposure. And we have to look at the long term. And we also have, we know very well that the thermal-only standards are outdated and non-protective. About protection, as I said, better coordination is required between the different between the different ministries, and a clearer message for protection. Even if someone believes that the scientific truth is not yet clear enough, still there is word for protection, and it should be said more clearly. That is my opinion, and I must acknowledge the funding I received to meet Professor Gandhi in Utah, and to buy some measurement equipment. That's it. Thank you. Thank you.